This is our, I'll call it our first annual event. When we decided we were going to do this in December of last year, we thought it would kind of be a good experiment to put a bunch of professionals together that kind of work with, call it the 50, 55 and up population, helping them with Medicare, Social Security, retirement planning, things of that nature. And we just wanted to see how it went. So I'm sure we'll make some mistakes tonight. I'm sure there'll be some hiccups. But the way that things are going to go today is we're going to start with Matt Kerr, who's going to come up in a moment. And after every one of the speakers finishes, I'll allow 1 or 2 questions, and then we're going to move on to the next speaker, just so we can kind of keep the evening moving along. The goal is for all of us to speak between 15 and 20 minutes and no more. I will tell you right now, I'm probably going to be guilty of being the longest speaker. I'm just guessing. I'm going to try really hard not to, but that's not my forte. I'm very long-winded. So we'll do questions in between, just a couple. And then at the very end, every one of the professionals you're going to be hearing tonight will stick around after the event's over to answer any questions that anyone has until the last person leaves. So without further ado, let's get the ball rolling with Matt Kerr. Matt's a benefit advisor with Seniority Benefit Group, which is located in Dublin. Seniority Benefit Group is a Medicare guidance firm that works with beneficiaries turning 65 or planning to retire, as well as during the annual enrollment period each fall. Matt currently resides in Grandview. In his free time, he enjoys golf, skiing, and spending time with his family. So Matt, why don't you come on up, give him a hand.
Thank you. I don't usually get 2 devices. This will be interesting for me. Thank you first off for everybody coming out this evening. This should be a lot of good information across several different important lines for everybody here this evening. Again, my name is Matt Kerr. I'm with Seniority Benefit Group. Some of you may have seen some of our literature in the mail. We're the Muffin Company, the Medicare and Muffins. That's us. So we hold a lot of educational events throughout town, different libraries, different community centers. But tonight we're going to do an abbreviated version of that presentation. So I'm going to touch on a few of the key pieces of Medicare. We're going to talk about traditional Medicare, supplements, Medicare Advantage, how the prescription drug coverage interacts with all that. And then, like Adam said, if you want to pull me aside after the event, if you have a more personal question, don't hesitate to pull me aside and we'll kind of think things through together. So a little bit more about Seniority Benefit Group. I think we're a pretty unique organization. We are an independent insurance agency. So the reason I point that out is if you see a solicitation from an insurance carrier, we probably work with that same company as well. So we're able to take a step back and see what is going to work best for the customer. And that might change over time. What works for somebody at 65 might change at 70 or 75. So we always have to revisit things and make sure that you are doing what's best for you as the consumer. We are headquartered just down the road here in Dublin. Anybody been through that new roundabout at 161 and Riverside Drive? We're just south of that. We do hear a lot of horn honks, and we get some crashes pulling into our parking lot from time to time too. But we encourage folks to come meet with us over at our office just because we're able to do a little bit more on a personal one-on-one setting. And then we're very proud of this last bullet here. We currently represent over 8,000 Medicare beneficiaries throughout Ohio, and then we do have licensures in other states as well. So if you have friends or family that live out of state, we might be able to help them just depending on where they do live. So what we're going to cover tonight, and I'm going to try to be prompt and stick to my 15 minutes here, but we're going to talk about the basics of Medicare, and then what coverage options you might have. Everybody's scenario might be a little different. Some of you might still have a formal retirement health plan through an employer. Some of you might have been a veteran or TRICARE beneficiary. So everybody's scenario is a little bit different. And then we're going to talk about also that Part D prescription drug piece, as I mentioned earlier. This can be drastically different for folks, especially if they're coming from a very rich employer-based plan. So we're going to talk about how that works. And then we're going to wrap up with what we call the Seniority Benefit Group client experience. So not only how we work with our customers up front, but how we renew them each year in the fall. Because guess what? Next week is October, and that's going to be the kickoff of the annual enrollment period. So it's going to be here very, very quickly. A little bit about Medicare. So a lot of folks don't realize at times Medicare is actually a health insurance program that is run by the federal government. It's the nation's largest health insurance plan. Even after the passing of the Affordable Care Act, Medicare covers over 50 million Americans, and there's some crazy statistic about 10,000 baby boomers are aging in on a daily basis right now. So not only is it already the largest, but it is ever growing rapidly on a daily rate right now. It's governed by CMS. So CMS is kind of like how the IRS is to your taxes. CMS is the overseeing watchdog, making sure that all the plans are playing by the rules and doing what they say they're supposed to be doing. And it was established back in 1965. Now, with traditional Medicare, it hasn't changed too much since the original rollout. I think they did a fairly sound job with that initial rollout. We're going to break down Parts A and Part B. So this is what is known as traditional Medicare. So the only piece in this whole process as you're going through the Medicare route that is between you and the government is going to be Medicare Part A and Medicare Part B. Every other piece is going to be a private insurance plan to some degree. So with Medicare Part A, this is going to cover your heavier inpatient types of services like hospitalization, hospice care, skilled nursing, all falls under Part A of Medicare. In order to be eligible for Medicare, you either have to be turning 65, or we do have some folks that are under 65 that are eligible for Medicare if they've been receiving Social Security disability for 2 consecutive years. That can also trigger a Medicare eligibility. For most folks, you're not going to have a premium for the Part A piece of Medicare because this is what you've prepaid through Medicare taxes. As long as you and or your spouse have met the 40 working quarter requirement, you're not going to have a premium for the Part A side. Now for Part B, we're going to have the same exact eligibility requirements. You have to turn 65 or have Social Security disability for 2 years. But now we're going to cover our day-to-day outpatient services under Part B. This is going to cover events like your doctor visits, outpatient surgeries, ER visits, all fall under Part B. And we also have a monthly premium for Part B. Currently, 2019, the standard monthly premium is $135.50. That is per person per month. So one thing with Medicare Part B and the premium, this is income-based. Depending on your adjusted gross income 2 years prior, you can have what is called IRMA, income-related monthly adjustment amount, added to your $135.50. I'm not going to get into the weeds on that piece tonight, but just a quick number for everybody. If you file single, that adjusted gross income is $85,000 is the limit. If you file jointly, it's $170,000. So if your adjusted gross income is below that threshold, then you will receive the standard rate. If you're above that threshold, there's going to be some surcharges to that benefit. Now, if you walked around town with just traditional Medicare, your red, white, and blue A and B card, it's not a bad health plan. It's about an 80%, 20% split between you and the government. Government picking up 80% of the bill, you being responsible for 20% of the bill. I really only have 2 complaints on the original structure. I think they did a fairly sound job. First complaint is they didn't add any outpatient prescription benefits. Well, back then there wasn't really a big need for that line. The bigger issue, in my opinion, is actually that 20% gap. So most of you in the room are used to having an out-of-pocket maximum limit built into your health plan, where it caps your worst case scenario. Medicare, traditional Medicare by itself, did not include that limit. Had they included a $3,000, $4,000, $5,000 out-of-pocket limit, I think people would be comfortable with that 20% coinsurance. But since they didn't, that's why folks tend to add some additional coverages to Medicare. So what else are people adding to Medicare? Well, believe it or not, about 2% of Medicare eligibles use traditional Medicare by itself. So they're comfortable with that 20% gap, and that's all they use. We're seeing more and more folks work past 65 as well. You know, if you like what you do and you continue to work past 65 and you're part of a large employer group plan, and what I mean by that is you have 20 or more employees on that health plan, you actually have the ability to push off Medicare, and you'll have what's called a special enrollment period when you go to retire and step away from your employer plan. Anybody lucky enough to have a formal work retirement plan? I know they're getting few and far and in between. STRS and SERS are a few that still offer some programs, but even PERS and some of these other larger groups, Ohio Police and Fire, we've seen them kind of dismantle their programs. So if you do have a work retirement program, I would encourage you to reach out to that benefit administrator to get some more info on that, just because that is going to be a privatized plan for you. And then also with the VA and TRICARE, those are phenomenal lines. You know, if we have any career military folks in the room tonight, first off, thank you. But you also have phenomenal benefits under TRICARE, and that basically follows the Medicare network. It's a really good plan. Where we're able to help folks is going to be these last two bullet areas, and that's either a Medicare supplement plan, adding on a standalone Part D prescription drug plan, or Medicare Advantage with the prescription drug already included. So first we're going to talk about supplemental benefits. Now some of you may have seen some literature called Medicare Supplements Medigap plans. Those two words are interchangeable. And they're going to do exactly what the title says. They're either going to supplement the 20% gap left behind by Medicare or fill that gap. Even the supplements are privatized plans. So just the A and B is with the government. You then go and purchase a Plan F or a Plan G or Plan N supplement with a private insurance company. Now, a key feature with all supplemental benefits is they're federally standardized plans. Now, what I mean by that is the coverage and the network is identical across the board. So if I have, a supplemental plan with insurance company A or insurance company B, same network, same plan design, but they're going to charge different rates between the different programs. So they each set their own premiums for that plan. I do want to mention real quickly, Plan F is the most comprehensive supplemental plan available in Medicare. It literally fills the full 20% void that traditional Medicare leaves behind. All good things come to an end though. Plan F is being phased out at the end of this calendar year. For those of you that might have Plan F supplement in the room this evening, you're going to be okay. You're going to be grandfathered into that benefit. You can keep it, but folks coming into Medicare January of next year and beyond won't even have that as an enrollment option. But fear not, Plan G, as in girl, is going to be your next most comprehensive plan available at that point. And it's still very comprehensive. I don't want you guys to feel like you're missing out on this great thing. Real quickly, with Plan G supplements, the member first has to pay the Part B deductible. That Part B deductible is currently $185. It's an annual deductible. You meet that once, you're done for the calendar year, and it then covers you at 100%, just like Plan F does. So there's still good options out there. A key feature with all supplemental benefits, though, is they're not technically health insurance plans. So the reason I point that out is the supplement will only cover what Medicare also covers. Remember, I mentioned earlier, original Medicare did not cover outpatient prescription benefits. That's why if you add on a supplement plan, you still have to add on a standalone Part D plan to help with anything you fill at the pharmacy. If I have a supplement plan and I have a medication administered at the doctor or hospital setting, odds are that's going to be gobbled up by Medicare in my supplement. But if I go to Giant Eagle or CVS or Kroger to fill my prescription, that's where I need that Part D plan to help fill out those costs. Positives about Medicare supplements. They follow the Medicare network, so you get to keep your doctors, your desired hospitals. It's the largest network across the US, Medicare is. There's no comparison to it. Now the downside, all supplemental plans are going to be age rated. They're all going to have premium based on age. Some plans will even base genders differently. Some blend them together, some split male-female apart. So you do get a premium increase every year as you age. My grandma's birthday is August 8th. I know like clockwork, July 17th, she's going to call me because that's when her premium statement comes. Her premium goes up and she's going to tell me about it every year. That's just because she got a year older. That's it. They didn't single her out because she had a surgery or a hospitalization, but she gets that age increase each year. Now, generally speaking, with Medicare supplements, you're going to pay higher monthly premiums, but the result of that is it greatly reduces your out-of-pocket exposure on the back end for medical services. So we like to think of a supplement as the pay me now option. Think of it as a prepayment of your insurance. You're paying more in premium, but then very, very little on the back end as you use it. Next, we're going to talk about Medicare Advantage. So Medicare Advantage is kind of the flip side of the supplemental coin. A few things you trade off if you go with a Medicare Advantage plan is, first off, the rating system. Remember, supplements are age rated. You get the premium increase each year. Well, Medicare Advantage is what's called community rated. So it is as finicky as Franklin County, Delaware County, Union, Madison, all have slightly different plans available. In fact, we had a customer move from the north side of County Line Road to the south side. Well, that triggered a shopping process because she went from Delaware County to Franklin County. So the county you live in dictates what's available. The plan you choose and that network dictates where you can access care. But you're going to have HMOs, PPOs, very similar to the benefits that most of you probably have through employment. You also have predictable cost sharing. So you have known copays for a service as you go in for that. So what I mean by that is most plans will probably charge $5 to $15 to go see your primary care doctor. To see a specialist, probably $40 to $50. But even a service like an outpatient surgery usually varies between $250, $300 copay. Or a night in the hospital, $350, $400, just depending on that plan. They're also going to have the out-of-pocket maximum limit built right into that. So in your worst year, if you were to reach that out-of-pocket threshold, you'd be done paying and the insurance company then would step in at 100%. Also going to include the Part D prescription drug plan built right into the Medicare Advantage plan. So what I want you to think about Medicare Advantage as is a bundling program. So Medicare Advantage is going to take your Medicare Part A and Part B, and it's going to add in a Part D prescription drug plan and just bundle it all together into one privatized plan. A lot of these coverages are going to include what we call value-added services. The big one is silver sneakers and some of these gym memberships. Also, dental and vision can be in there, but asterisk on that is it's not usually as great as it's sold on these TV commercials at times, especially dental. Dental is a frustrating benefit line, to put it candidly. Now, with Advantage plans, regardless of age, regardless of gender, everybody in that county pays the same rate. Okay, so it truly can be, Medicare Advantage plans can be as low as $0 and above, just depending on the one that you choose. I will say, most of our customers that have Medicare Advantage plans actually pay $0 in premium for that benefit. I don't want you to think that means inferior coverage, because it doesn't. Oftentimes the $0 plans are the richer benefits that are out there. There's only one medical question that is ever asked if you were to join a Medicare Advantage program. That is, do you have end-stage renal disease, also known as kidney failure or renal dialysis? As long as you say no to that question, you can join any Advantage plan that's offered in your county. Okay. Lastly here, we're going to finish with the prescription drug benefits. Oops, I gave you a little teaser into the second one. There's 3 different stages to every prescription drug plan out there. If you get your prescription benefits standalone with a supplement or built into your Advantage program, they play by the same rules. The first stage is the copay stage. This is when life is good. I pay a flat copay to go fill my medication. But guess what? CMS, who governs Medicare, they're keeping a constant tally on the full cost of your prescriptions as you're filling them. So if I'm filling a low-cost generic that maybe costs $10 full cost, not a big deal. But if I'm filling a brand name medication, maybe it only costs me a $45 or $47 copay to fill it, but the full cost is $400 in the background. Well, Medicare is going to ding me for $400 every time I fill that. Over the course of 2019, if a Medicare beneficiary goes through $3,820 in full cost of medications, they go from paying the flat copay into the second stage, which is known as the donut hole or the coverage gap. If somebody hits that donut hole or coverage gap, they now pay 25% of the full cost. I like to use my younger sister as an example. She takes an Advair Discus. That's probably about a $45 copay to start off. Well, it's about a $400 a month full cost prescription. So if that's all she took, about October-ish each year, she's gonna hit that donut hole where she goes from paying $45 to 25% of $400, and now she's paying $100 a month to fill that same med. So they have been shrinking this donut hole over time. This is the smallest it'll get though. So going forward, 25% is going to be the cost share limit on that. There's also a third stage, which is known as the catastrophic level. If a member hits that third and final stage, they pay 5% for the remainder of the year. There is no cap to prescription drug benefits in Medicare. But once you hit January 1st, everything resets back down to the copay stage and you're back to that first level, okay? Now I know I've thrown a lot of stuff at you guys here in a real quick fashion, but real quick before I go, I want to wrap up with what we call the SPG client experience. So we're real excited because next week is the start of the annual enrollment period and we're rolling out a new database for our customers. We've purchased a system that's hopefully going to allow some streamline as people are shopping and making changes to their plans. But the way that we work with our customers is, first up, we need to get at least a small analysis. The first thing I ask from folks is a list of medications, a list of doctors. Not every plan is going to work well for everybody, so we have to weed out the ones that won't. We're going to do a lot of research for you. It's mainly on the prescription side. These companies can view medications drastically different at times. What one company calls a tier 1, another might call a tier 3, so you have to be watchful of that. But we also help folks with that plan selection and then also the enrollment process. And then what makes us very unique is we have year-round support in our office. I can't stand it when I get a call that starts off with, I just spent 45 minutes or I just spent an hour and a half on the phone with 1-800 helpline. I want people to call our office first because we might be able to alleviate a lot of that stress that comes with a call center. And then lastly, we give the annual advice each fall. For those of you in the room that might be on Medicare already, the annual enrollment period starts October 15th and it ends December 7th. If you make a plan change in that window, the change takes effect January 1st. It's not immediate, but it does change January 1st. All right, that is all I've got from you. I've got 2 question limit here. Anybody? Come on, there's always a couple. Yes.
I just want to add something to the Medicare Part B information that you're providing to everyone, because I know they look back 2 years at your gross income.
Yep.
And it's also based on your income, but I do want to let everyone know you can appeal that decision.
And they're very forgiving.
And they are very forgiving.
They are, yes.
Because you do have forms you have to complete. You have to have your employer complete plan form. Mm-hmm. And it's a life-changing event.
It is, it is. No, thank you for bringing that up. She brings a good point. If you do find yourself in one of those high income earning situations, don't tense up too quickly, because there's a good chance that we might be able to shake that penalty. Because also what comes with Medicare with a lot of folks is retirement. So you have a life-changing event that takes place at that same time. Thank you for bringing that up. Yes, sir.
When you do a 2-year look back, let's say to 2017, and that would put you in higher brackets, but your birthday is in October. Do they only charge you October, November, December from 17, or did they go 12 months and then catch up with the change in October of the next year?
Good question. It's a constant 2-year look back. So right now we're in 2017, but as soon as we hit January, they're going to be in 2018, just like that. Yep, good question. Yep.
Let's take one more, Steve.
I get one more.
If you are still working and you're covered under an employer plan, so can you take Part A and postpone taking Part B until...
I'm glad you asked this. I was so torn on whether or not to leave this in the slides or not, and I'm glad you asked. So his question, for those of you that maybe didn't hear, if you're going to continue to work past 65, do I have to take Part A, Part B? How does that work? So Medicare is only the primary payer in a small group situation, which means under 20 employees on the health plan. If your employer plan has 20 or more on it, you can push off both Part A and Part B if you want to. Here's where the wrinkle happens. HSAs. Anybody have HSAs in the room? If you and or your employer want to contribute into that health savings account, you have to stay out of both Part A and Part B. For whatever reason, you had Part A, the IRS says, sorry, you're not eligible to contribute to that anymore. So that's an added little wrinkle to that, so you have to watch it. But if you don't have an HSA, most of the time folks do enroll in Part A because you have inpatient secondary benefits to your group plan if you were to go to the hospital.
And then you still can enroll in Part B.
You'd have a special enrollment period at retirement that would trigger your enrollment into the Part B. Yep, good question, yeah. That it? All righty, well thank you folks.
All right, give Matt a hand again. Matt won't say this about himself, but I'll say that, you know, whether you work with an agent, whether you work with someone online, whether you work directly with an insurance carrier, somebody's being paid for that service no matter what. So I think they do a really great job of working with people and making it easy and comfortable and you know, at a time in life when a lot's changing. So let's bring up our next speaker. I'm really excited to bring up Gina McElroy. Gina started Senior Support Services, a geriatric care management business in 2007 after working for over 10 years in the long-term care industry. She has a passion for serving older clients and helping them experience quality of life through the aging process. She's a graduate of Wittenberg University. She's a certified geriatric care manager, a certified dementia practitioner, and a certified dementia and Alzheimer's disease care trainer. She serves on the Midwest chapter board of the Aging Life Care Association and is a volunteer guardian for the Area Agency on Aging. She also volunteers on the Alzheimer's Association Speakers Bureau. In her free time, she enjoys spending time with her husband and 2 kids. And Gina, I'll bring you on up. Give her a hand.
Do I still need this? Okay. Hello. It's nice to see all of you here. I am Gina McElroy. I own Senior Support Services, which is a geriatric care management organization. And I am here to talk with you about aging well. Oh, hold on one second. There we go. Okay, so one thing that is for certain is every day, all of us are getting older. From the moment we're born, we're aging. So the average age right now for a female is 81.1 years, and for a male, it's 76.1 years. With all of the advances in medicine, these ages are going to increase. I recently heard a study that guesstimated that in about 40 years, the average lifespan could be up to age 125. So as we potentially may live that long, or maybe some of our kids may live that long, or grandchildren, it is important to know how can we age well. So my question for you to begin with is, how would you define aging well? What does that mean to you? Does it mean that you live a long time? Does it maybe mean that you have no regrets at the end of your life? You feel just overall satisfied with your life? Does it mean that you have no aches and pains? Maybe you enjoy each day to the fullest. Maybe it's to pass a legacy onto your family. So there are normal changes that happen with aging, and then there are some that are not so normal. Some of the normal changes that we all see, you probably might be doing a checklist up there of what you've been experiencing or noticing. You know, the loss of elasticity of your skin. We get aging spots, as they're called, you know, the more sun damage we have. Our joints begin to stiffen. We might find that doing yard work, raking the leaves or shoveling snow, we start to have a sore back earlier than what we would have when we were younger, and we might have to take more frequent breaks. The heart muscle begins to lose strength as we age. Our respiratory system does not function as well as it used to. Our metabolism slows down. A lot of times our kidney filtration will decline with age. We don't see as well. Our visual acuity diminishes as we age. We begin to taste and smell less as we age. I had a client at one point, she was 90 years old, living in an assisted living, and she made the comment to me that she loved the cookies they had at this assisted living, but she was concerned that her thighs were going to get too big if she had these cookies. And so I asked her, I said, are you telling me that even at 90 years old, women are still thinking, oh gosh, I don't want my thighs to get any bigger? And she said, yes, it doesn't stop. She said, however, if I could go back to age 30, I would eat all of the cookies I could, because I would realize that at 90, I wouldn't be able to taste those cookies as well. So I should have enjoyed them while I could eat them and taste them really well. A lot of times our reflexes and our reaction times are slowed down. So that's why a lot of times we have to take the car keys from someone that we love, because we realize that they're just not as safe behind the wheel. So as we age, the best way to age well is we want to stay independent. So how can we maintain our independence and not have to rely on others for meeting our daily needs? Being proactive and not reactive, you know, that's something that just applies to so many areas of life, but especially for aging. You know, a lot of times people will say, oh, I don't need to go to the doctor. I don't need to go to the dermatologist. I'll wait until something comes up that's suspicious. Well, if you can be proactive, you're going to avoid a lot of unpleasant crises down the line. Those crises can also be very expensive. So if, you know, maybe spending some money in copays to go to the doctor now, it's going to be a lot cheaper than paying for hospitalization or surgery because of a fall, something along those lines. You also want to do for yourself what you are still able. I think a lot of times, and I am guilty of this with my own parents, I tend to want to jump in and help. And it's important that as long as we are able to do a task and do it safely, we should be able to still do that. We should still do that so that we are not going to lose that ability to do it down the line. We want to stay active. To maintain your independence, you want to accept help as needed. So again, do what you can on your own, but if you need help with something, there's no harm in asking someone to help you. So if you get to the point where you're thinking, you know, I'm not feeling quite as steady on that ladder anymore, I think I'm going to call my grandson and ask if he could come over and hang up Christmas lights this year. And again, going to the doctor regularly is a way to be very proactive. So when we talk about aging well, due to time, I could talk all evening about this, but I tried to take it down into 4 different areas. So looking at socialization, our exercise habits, our dietary needs, and looking at brain health. So with socialization, we want to avoid isolation. When people are lonely, they have greater rates of depression. A lot of times they have more health issues. So it is very important to make sure that you stay social. Now for some people that may be different than others. So for an extrovert, that may mean, oh wow, I need to go out, I need to go to dinner with 10 of my friends. For the introvert, it may be, I think I'm gonna just get together for lunch with this one friend and we're just gonna spend the afternoon just the 2 of us. Either way, it's socialization, so there's no right or wrong way. You wanna try new activities. So as you're aging, you may find that there are some activities you have to give up. For example, using the ladder. Although most people wouldn't say that it's a fun activity, but let's say somebody has some back issues, maybe they have to give up golf, and they used to love golf. If you have to give up something like that, try to find another activity that can take that place. It doesn't necessarily have to be a similar activity. You could try something new. You know, maybe you can square dance. You know, maybe that doesn't bother your back. Maybe you can start volunteering at a hospital in the neo-intensive care unit and hold babies. So find something else to replace those activities that you do have to give up. Again, if you're around other people, you're avoiding that loneliness, you're going to avoid depression as well. Something that is interesting about depression is if somebody has untreated depression, especially as we age, it can mimic dementia symptoms. So that person may have trouble thinking clearly. They may start to withdraw from social situations, and they may feel more tired. So it is important to make sure that you are doing all you can to avoid depression. And if you do start to feel depressed, go and get treatment for it, because it really can keep you from having to deal with other issues down the line. Socialization is also good for the brain. As we are communicating with each other, we have to process the information that we're hearing. The more your brain hears, the more your brain has to work. So you're exercising your brain. With exercise, You have to use it or lose it. You often hear that, and it is so true with aging. When you do lose it, it's okay, find something else to do and use it again in that new activity. You want to move every day. It truly does not matter what movement you're doing. Some people may enjoy walking, some people may enjoy swimming, golfing, but whatever you're doing, make sure that you're doing something each day. If you find that due to a surgery or another ailment that you have that you are confined to a chair, there are still exercises you can do while you're sitting. You can lift your feet. They have a lot of different videos on YouTube, and you can purchase them through like Amazon that they have. It's like a sitter size. So you're actually in a chair, but you're still working your arm muscles and still exercising. As we age, we have to modify the exercises we do. My husband and I, as we've gotten into our 40s, we are realizing we can't still work out as though we're 20-year-olds, as my husband has a torn rotator cuff as a result. So we learned that the hard way. So you definitely have to modify your workouts as you age. And of course, exercise is going to help with that brain circulation, which again, it's good for your brain. And preventing falls. It's going to improve your balance. I cannot tell you how many people I have witnessed that have had one fall and all of their independence is gone within that one fall. So if there's anything that I can encourage you to do, it is try to work into balance exercises into your daily routine. So it could be testing yourself, how long can you stand on one foot without moving? Try to increase that time each day. I wouldn't try to balance like by using a ladder. So make sure you have safe shoes that are sturdy and they're not slippery on the bottom and that you have a solid surface, but really try to incorporate balance into your exercise. So diet, we all hear about the brain diet. It is very close to the Mediterranean diet. A lot of the leafy greens. We're trying to get fresh fruit, vegetables, lots of color on your plate helps you get a lot of the vitamins that you need. Looking at whole wheat, trying to eat beans and nuts. You want to minimize how many red meats that you eat. It is important to have some red meat as it does have iron in it, but of course, trying to choose chicken or pork or fish is very good as well. If you can follow a good diet. Now, I am one to say there is also quality of life, so my quality of life includes some cookies sometimes. So I think it's okay to do everything in moderation, but you definitely want to try to incorporate more of these foods into your diet to help your brain. You can see at the bottom, there are some other brain foods, so coffee and walnuts, dark chocolate, again the fish, spinach, carrots, berries. Those are all going to be very good for your brain and for aging well. You can see all of the different ailments on there. If you have a good diet, you're going to have lower rates of these issues. And these issues are those that can, again, strip you of your independence and help you not age well. It will cause you more problems as you age. So brain health. A lot of people say, is this dementia or is it normal aging? So there are changes in our memories as we age, and that happens to everybody. So you may say, oh gosh, I've lost my keys. Is that a problem? Does that mean I lost my keys last week too? Does that mean that I have dementia? Well, not necessarily. It's a problem if when you find them, they're in the freezer, because then you have to think, now why did I think I should put my keys in the freezer? So that's when it could become a problem. But if you lose your keys and you find them in your purse or in your pants pocket in a normal place, then most likely it's just that normal aging. Someone says, oh, my utilities have been shut off. Well, this is something, it could happen that you miss some bills, but if you've missed enough bills that your utilities are shut off, that could be a sign that you're starting to lose some of your ability for executive functioning skills. And that is a beginning sign of dementia. So you will want to talk with your doctor about that. If someone says, I cannot think of words, I used to be so quick when I was speaking. Well, that is something too. That's just normal aging. Sometimes that happens. If it becomes a very noticeable pattern for you and it's interfering with your daily life, that's when you would want to consult with your doctor. I got lost in my own neighborhood. So if someone says this to you, that is a sign that there could be some cognitive impairment going on. If it's something that you, say you go to the same grocery store and you've gone there for the last 30 years, and all of a sudden your spouse comes home and says, I honestly got lost and I couldn't think how to get home. That is a sign, because that's something that should be pretty routine, and that could be a sign again that something is going on. Now let me add, well, I'll add that in a couple minutes, but some of the warning signs of dementia, and this is compliments of the Alzheimer's Association. So if you have memory loss that disrupts your daily life, again, if your utilities are shut off, that's impacting your daily life. If you have challenges in planning and solving problems, a lot of times this symptom shows up when somebody's still working full-time, and their coworkers and boss, they're saying, there's something just not quite right. Difficulty completing familiar tasks. Again, a lot of times that shows up when someone's still working. If you have confusion with time or the place that you're at, again, getting lost easily, you have trouble understanding different visual images or spatial relationships. You know, if you walk and it looks like there's a step down, or you see someone kind of walk over this way if there's a checkered floor, that's a sign that there's something cognitively not working quite right. If there are new problems with words, and this seems to come on gradually, that could be a sign of dementia. If you're misplacing things and you lose the ability to retrace the steps to find it. If you have decreased or poor judgment, withdrawal from work or social activities, so you can see that some of those symptoms can be depression as well. So it's important to really be able to determine between the two and talk honestly with your physician. And then changes in mood and personality. So these are typical age-related cognitive changes. So we're all going to make a bad decision every once in a while. We may miss a monthly payment just because it gets shuffled under the pile, or we're busy. We may forget what day it is, but if you recall it later on, or if you forget a word, and 2 hours later you think, oh, I need to text that person, I just thought of that word that I'd lost, then that is normal cognitive aging. If we are losing things from time to time, that is normal as well. So in summary, to age well, we need to be proactive. We need to stay active. We need to eat healthy foods and stimulate your brain daily. But most importantly, we need to make sure that we enjoy each day to the fullest. None of us know if we're going to be the one to live to 125, so we need to make the most of each day. Does anybody have any questions? Yes?
So how does your company help these?
Sure. So what we do is we, as geriatric care managers, help navigate that entire elder care network. So when you have those questions, you know, I see that there's something wrong, but I don't even know where to start to get help. So we would be kind of that glue that holds those pieces together. We can be a guide for the journey. So you're thinking, okay, I'm starting to see some forgetfulness in my parents or in my spouse. Is this something to be concerned about? Then we can come in and we assess the situation, assess what your needs are, and we can help you get a plan in place to, one, address the deficits that you may be seeing now, but also to help you maintain the independence you still have and maintain those areas that are strengths for you, to avoid, you know, one of those costly crises down the line that could be a hospitalization or something like that. Yeah. Yes?
Are you just in Franklin County?
No, actually, I was sharing with them earlier. I'm familiar with the regulations and things for all of the state of Ohio. Typically, I am in the Columbus area, but I've served clients in Licking County all the way down in Athens County, Marietta, down by the river. So I've been up to Marysville, Marion. So yeah, it's all over the state of Ohio. Yeah. If there are any other questions, feel free to catch me afterwards. I will be sticking around.
All right, thanks so much. All right, thank you, Gina. I just want to say that Gina, we've had her working with some of our clients this past couple of years, and she's done a phenomenal job. And obviously, I think she shared a lot of great information, but I just also want to share that, one of the things I think she does really, really well is help families who maybe have another family member who might have some issues, identify those issues that might be leading to dementia and Alzheimer's, and help the family cope with that process. Because obviously, I don't have to tell you how uncomfortable that can be when you're starting to discover that maybe a parent, or worse, a spouse, is starting to experience some of these things, and then trying to identify it in the most comfortable way possible and move through that process. So yeah, thanks so much for sharing all that, Gina. I'm going to ask Beth Sanders to come up, and I'll give an intro here, and I'll let her talk, and then I'll probably chime in with a couple things afterward. But Beth is the founder and CEO of lifebio.com. Anybody by a show of hands ever heard of LifeBio? Okay, a couple. So pretty cool. So it's a Marysville, Ohio company that has the mission of encouraging all people to record their personal life stories to create a lasting legacy. She's the author of the biography questions available at lifebio.com and in LifeBio's journals. She was inspired by her own sweet grandmother's simple but unique story. And Beth has a bachelor's degree in English and journalism from Otterbein University. She's married to Jeff, and they have 2 children and 1 14-year-old amazing dog. And she enjoys world travels and road biking. So I'm going to let Beth talk a little bit about LifeBio and how neat this is. Give her a hand.
Thank you. Hi, everyone. Thank you for coming here tonight, and it's a privilege to be able to speak with you. I will make sure I know how to use the clicker here. And LifeBio is free for clients of Libertas Wealth Management Group. Are there other slides that I have or not? Okay, I wasn't sure if we loaded those in. No problem. Okay, they're here? Should I keep going? Okay, good. No? I don't see them here. That's okay, though. I'm ready. It doesn't matter. One bit. Okay, everybody. So I want to tell you about 2 amazing people, and I won't take a whole 15 minutes to do it either. I have 2 people that made a huge difference in my life. One was my grandmother, Margaret Stitzinger, who lived in my backyard when I was a little girl. I basically grew up on the same street with her in a beautiful road named Loveland Avenue in Erie, Pennsylvania, which was well named as Loveland Avenue. And I got to hear my grandmother's stories, and they made a huge difference in my life, and I realized that this grandmother I had was also once a little girl, and then she was a teenager, and then she was in high school, and then she went to college, and she got married, and she had children, and then she had me as a grandchild. And I thought, wow, Grandma, you are amazing, and I only saw you as a grandmother, and now I see you as a whole person. How many in this room have the most amazing grandmother in your past that comes to your mind? Anybody had an amazing grandmother? Hold your hand up high. You had an amazing grandmother, am I right? And, okay, how many had amazing grandfathers? Anybody had an amazing grandfather? Good. Okay, now, the other person that impacted me was my father, and he was a Vietnam veteran. He was in, if we have any Vietnam vets, he was in Pleiku, he was in the Battle of Dak To, he was in Vietnam in 1967 and 1968, and he had a chance to share some of his story with me. And it was, and that was just a piece of his story, because he was a farm boy, and he was a postmaster, and he was a good dad, and he worked really hard, really hard. So anybody in this room have a parent or a parent who worked really hard? Okay, and so you have learned all these things just like I did from these amazing people in your life that made a big difference to you. And so from their stories and from thousands of people's stories now, LifeBio has helped a lot of people tell their story. And I want you to know that there is no one else like you. You are amazing and you are unique. And you know about these incredible parents, and you know about these incredible grandparents. And so I'd like to encourage you to think about that legacy, that you have a chance to pass on information. If you know about your grandparents, you in the room have grandchildren, they can actually learn something about their great-great-grandparents from your memories of them. So you kind of have a little responsibility here to pass on a legacy. Because it may be, okay, some of you are going to say, I have nothing to say, nobody wants to hear about me. Okay, then talk about your parents and your grandparents, because you have their story in your head. You know the advice they might have given you or the help they gave you along the way. The other thing is, some people say, well, my life isn't perfect. I've had a very difficult life. Everybody in the room who's had a perfect life, just raise your hand. Who in this room has it's been nothing but a bed of roses, right? All of us have had, it's like a roller coaster ride, right? You know, it's up, it's down. It's not easy. Life is hard and it sucks at times. So the thing is, as Grandma was telling me her story and I was hearing the hard times, as my father was telling some of his stories and I was hearing the hard times, it's an inspiration to me. And it's an inspiration to my kids who sort of know these people, and it will be an inspiration to my future grandchildren. So I just want you to think about that. You're going to talk about people who shaped you, childhood memories, historical events that impacted your life. You're going to talk about your work experience, military service, if you served in the military. You're going to talk about philanthropy and volunteerism, what really matters to you, right? You have this money that you've maybe found a perfect charity that you love to give to. Why is that charity important to you? Document that for them. Hobbies, interests, beliefs and values, the future. So here's the other thing. I wish people would not wait till they're 92 to do this process. Because when you do it when you're younger, like I've already done it for my kids. When you do it when you're younger, you go, oh my goodness, I love biking. I loved it when I was a kid. You know what? I still love biking. I'm going to buy an endurance road bike. That is a hobby I want to do. I'm going to Vietnam next year. I will be in Vietnam from April 2nd to 27th. I want to see this country. So it allows you to tap into, okay, what have I done? Where have I been? And now where do I want to go next? Because the future is there. And a lot of you are going to be here for 30, 40, 50 years here, okay? So plan accordingly and get it documented, and don't let your kids and grandkids not have that legacy, okay? That's it for me. These guys have a journal that, do you want to tell them
Yeah, I was just going to say, we have, no, you're fine. Yeah. We discovered this, actually it was a product of Zach and Gene at our office coming up with this idea to basically start capturing people's stories. And it all started actually with my grandmother. So my dad is from Hungary, and they escaped in 1956 during the Communist Revolution. So she has these stories of hiding under bridges with troops walking over top, and she's seen people get killed on boats. And so just these crazy, crazy stories. And just like you were saying earlier, I think too many times, once one generation passes away, those stories are quickly lost. I mean, maybe what? 50% of the story is remembered by the next generation, and then once you go down to 2 levels, it's gone. So when you're done with these questionnaires, and there's several, there's so many you can pick from. For our clients, we use one big, huge book that has about 72 questions that encompasses all areas of life. But when you're done, you can submit up to 50 images, and the end product is a hardcover book with basically your life story in pictures and words, and obviously your words. So an amazing invention, we'll call it, that I can't believe we didn't know about sooner. So thanks so much again.
Yes. Thank you for having me. Thank you.
Okay, next we have Jeff Kunkler. Jeff is an estate planning attorney, partner, and chartered advisor in philanthropy at Carlisle, Patchen & Murphy. He's been named one of Columbus's top lawyers, Top Lawyer Magazine Rising Stars, and is rated AV preeminent by Hubbell Martindale's highest peer rating for ethical standards. Jeff received his undergraduate and master's from Case Western Reserve University and his law degree from the Ohio State University Moritz College of Law. So Jeff's going to come up and talk a little bit about Estate Planning 101, and I'm sure there'll be some questions here. So give him a hand.
Good evening, everyone. I'll try not to do too much participation from you all. It's a little little uncomfortable when they asked about my grandparents. But when the question about my parents came up, I was very uncomfortable because they joined us this evening. And so when I didn't say that they were hardworking, I felt a little bad. But that's because I thought I'd share just a quick story about them. And my folks, they're now proud grandparents for about 9 weeks. And we're trying to figure out childcare. My mom's coming down tomorrow to help. And what are we going to do when my wife goes back to work? But my folks were so hardworking and crazy that my mom voluntarily switched to second shift so that she could watch me during the day and my dad in the evenings, and they would pass just briefly for about an hour of time until I got into first grade. And so I have some very hardworking parents, and though I didn't raise my hand, I'd like to thank you both, so thank you. And luckily, I've taken them through estate planning so they can also speak to the quality of my legal services as well. As Adam said, my name is Jeff Kunkeler. I'm one of the partners at Carlisle, Patchen & Murphy. This is an hour presentation that I've been asked to cut to a half hour before, and I said I could try to squeeze it into 15 minutes, so I'm going to try my best. The takeaway can certainly be that we work with a lot of Adams folks. You've got my contact info in there, and I'd be happy to answer any individual questions afterwards. But if we're going to get into estate planning, we need to figure out first, what's your estate? Well, at a very, very high level, we're going to take a look at your assets and your liabilities. The assets are, of course, your stuff, some cars, bank accounts, probably a house, those sorts of things. And your liabilities are the debts, so your mortgage, your credit card bills, etc. For a very simple example, if Joe's got a house and a car and a checking account, but he's got a mortgage, you'd take his assets, subtract his liabilities. That's his estate. What's planning for it? Well, planning for it can be very different for different individuals, but at the highest level, we need to figure out for Joe, what does he have and where does he want it to go? There may be some timing issues. Maybe Joe's kids and grandkids aren't old enough. There might be familial relations. Maybe there's people we do or don't want included, or a charity or a church or those types of things. It's our job to get whatever it is you'd like done legally, effectively done in the most efficient way possible. So it's preparing how you actually order your estate. For those folks who have a closely held business, that's kind of the bread and butter of my law firm. It's making sure if something happens to you, what do we do with the business? Could your wife or kids run it? Do we need to sell it? Is there an ability to sell it, or is it really just you trying to get the maximum value? And certainly we try to reduce taxes when we can. I don't have enough time to get into a lot of tax information tonight, but to the best extent we can, we of course help you out there too. So many people in here probably have some type of planning. The stats say actually slightly more than half of people don't have any planning at all. So if you don't have anything, you're not alone. Right now, 64% of Americans don't have a will at all, and it's getting worse. That was 57% back in 2011. And that's from an article in Forbes. There's a number of reasons why people don't have these things in place. The most popular answer that they said in this, they sort of did it Family Feud style. Out of 100 people surveyed, most popular answer was that they simply didn't think that it was urgent. And I hear that all the time. You know, I don't have a diagnosis. I'm not planning on dying tomorrow. Why do I need to set this up? The second most popular answer is people didn't want to think about death. I have a lot of people who say, I tried to bring it up with my kids over the Thanksgiving table, and they got grossed out and said, ooh, Mom and Dad, I don't want to talk about this. We don't want to know what's going on. It's really not that hard of a process. I know I've got several clients who are here in the room who can tell you we try to make it as easy as we can. I have a lot of people who think that it's not that important. They say, well, I don't have kids, or I'm not married, and we don't need to take care of this. The way our laws work, if you have a traditional family unit where you've been married once and all your kids are together, the law will probably get it pretty close to right. If you don't have that situation, so there isn't an obvious child, there isn't a spouse, then the law is probably going to get it wrong. There's some major advantages to planning in advance. One, you can have some major control. Two, tax savings. Three, anyone dealt with the probate court to any extent? The probate court's a really involved system here in Ohio. We have 88 counties, 88 separate probate courts, 88 separate judges. In a big county, so in Franklin County, there's a specialized judge with about 10 assistants who only handle those matters. In a small county like I grew up in Wayne County, the probate judge also has to deal with juvenile matters. Delaware County, same thing. They had to deal with those old Intangi kids who do those horrible things with the food testing, and then later that afternoon, he had to help out administering a will, figuring out where people's property goes. So depending on where you live, you may have someone very specialized or someone who doesn't do it all that often. In Ohio, it's court supervised. So each step, we submit something to court. You submit the will, they'd say, is it valid? We submit an inventory showing what all your assets are. We submit an account showing what we did. What debts did we pay? Who did we pay? So on and so forth. The court's involved at each step, and a lot of people don't really like that. They say, I don't want to have the cost. I don't want it to be a public process. And so for many people, we're just trying to keep it out of the courts. We don't need a judge there as a referee. My kids can agree and sort this out. And so planning can help you stay out of that. There's also some different types of protection we can talk about. We have a lot of people who are concerned about long-term care. Certainly if you want to work with a geriatric case manager, that's a wonderful step, but there's people who haven't planned for long-term care, and so we can talk to them about how do we protect the value of your house, other assets, those types of things, should you need that type of an event. You can also give some guidance, and I kind of call it a roadmap for your family. If I'm hospitalized, this son or daughter makes the healthcare decisions, this one makes the financial decisions, and who gets things at which timing. The main documents you're going to see in an estate plan, so these first few are what I call disability documents. First, there's a durable general power of attorney. We also just call that a financial power of attorney. Under Ohio's law, you can designate someone who can manage your finances if you're unable to do so yourself. So a lot of times we hear of someone who's getting up in age saying, I can't pay the bills, I can't write the checks, designates a son or daughter to do that for them. You want to do this in advance. So Ohio lets you pick someone. If we don't do it in advance with this document, then I have to go to court and get a guardianship for you. That's a public process, really expensive, really cumbersome. Similarly, we have a healthcare power of attorney. That's the other disability document. That document says if I can't talk to my doctor, who should they call? Do I want them to call my dad, who I know is going to pull the plug quickly, or do I want them to call my mom, who's going to be way too emotional about it? So I get to decide in advance who they get to do it. I don't know if they know who I've picked. Luckily, my wife's somewhere in the line, and she's going to make hopefully a good decision for me along the way. But you get to pick who you want to do it, and think long and hard. Who's a good healthcare person? Who's close? Who could get to the hospital? I want to pick the best candidates, not just pick my oldest child because it's the natural order. I'm the only, so they've only got one choice, but some of you may have a couple of options, and you can pick the one who will be the best candidate. You might have a living will as well. That's an optional document, but almost all of my clients, I would say at retirement and beyond, choose to do this. Ohio's law now says if you feel a certain way about end-of-life care, if you're in a permanently unconscious state, you can decide in advance whether you want to be kept alive in that vegetative state or if you should be removed from it. So anyone remember the Terry Schiavo case from Florida? There was a lady about a decade ago now who was in a coma. Her husband was told by the doctors there's no hope, so he said, let's go ahead and withdraw life support. Her parents disagreed and they sued the hospital and said, we think we should keep her hooked up. She might miraculously wake up. 9 years later, the highest court in Florida decided they were in the husband's favor and they did withdraw life support, but they spent 9 years of legal fees, 9 years of keeping her hooked up, and an enormous fortune all fighting about it, all because she didn't do something like this, saying, what would she like done if she's in that circumstance? All my senior clients say, I don't want my kids to have to make the pulling the plug decision, so they sign the document. Some of my younger folks don't make that decision, but now you can say, I want to have my parents, my spouse, someone make it for me. So it's really important to have. If you don't work with a lawyer, the second two there, healthcare power of attorney and living will, they're available online for free. I'd be happy to shoot them to you. All you got to do is write in the right names and contact info. There's no magic to it, and it's a good, simple starting point. The other core for what I sort of call a basic estate plan would be a last will and testament, which serves three purposes under our law. Purpose one, you say, who gets your stuff when you pass away? So is it equally to my kids? Is it all to the Buckeyes because they're having a great start to the season? Who do you want to leave it to? Ohio, if you don't pick that, will leave it to your closest relatives. And we literally pull out this table of what they call consanguinity, where I say, is it your first cousin or your second cousin once removed? And the chart says who gets what. If there's no one on the chart, the state of Ohio gets it. And so for those folks who don't have family, it's really important to do a will. The second purpose of the will is name your executor. That's the person who actually carries out your wishes. So the will might just say simply, sell everything and leave it to my kids. The executor is the one who's going to go to CarMax, who's going to hire the realtor, who's going to do all the heavy lifting. They do get a fee here in Ohio for their service, but that's a really important role. And then the third purpose of it is if you do have young kids like myself, you nominate who would raise those kids in the event you're incapacitated. So you have to have that tough conversation. Is it those grandparents? Is it the other grandparents? We actually have an extra step grandma along the way. So who's going to take care of, in my case, my daughter, if you pass away before they turn 18? So that's kind of the third important thing to do. If you've got young grandkids for a lot of the folks in the room, make sure your kids have at least these 4 documents. That's sort of a basic estate plan. And then finally, some people talk about trusts. I'll get briefly into the reasons we do trust, but in a 15-minute talk, I can't get too far into the weeds there. The will, as I said, has 3 purposes: who gets your stuff, who follows out those orders, and of course, who takes care of the little ones. You can also do that through a power of attorney nowadays. That was a recent law change about 3 years ago. How you own your property is really important. So I mentioned people try to avoid probate. There's a lot of sort of DIY tips you can take from this slide. So the will only controls certain property when you die, and that's what I'm going to call probate property. If you own property that's joint with another person, that doesn't get controlled by the will. It goes automatically to the joint owner. So nowadays we have joint tenancy with rights to survivorship on your house. That means it goes to your husband or wife when they pass away. Any bank account is presumed to be a joint account. So when the first spouse dies, typically almost everything's joint. We don't probably have to go to court unless they kept separate finances or a separate automobile. You can actually transfer cars to a spouse, an unlimited number of them, up to $65,000. That covers most people's situations. Anything with a beneficiary doesn't control, isn't probate property either. So anyone have life insurance? When you took it out, they ask, who do you want it to go to? That's the beneficiary. As long as that person's living, it will go to that person automatically. Now that's really important to make sure that our estate plan says the same thing as your insurance. I could drop a will saying you leave it to your 3 kids, but you have an old life insurance policy back when you only had 2 that says it goes to the 2 kids. Well, those 2 kids are going to luck out, and I can't guarantee they'll take care of your 3rd kid. And so you got to make sure you look at these from time to time. We work a lot with Adam and his team. They're really proactive, making sure that their beneficiaries are updated. They look at that over and over again on your 401k, your IRA, etc. But if you don't have someone like that, you need to do it yourself. And then finally, anything that's POD or TOD that's payable or transferable on death, that doesn't go through probate either, and that's all the other stuff. You can POD basically any bank account, you can TOD car, a house, those types of things. So through a collection of these tools, if you don't want to go through the time and expense of really having your lawyer do a lot of the work, you can work with a will and then these things to really accomplish a lot of your goals. Trusts, and again, this is just going through a very high level. These are the most common reasons I put trusts together for clients. If you want to talk about whether one makes sense for you and your family, I'd be happy to meet one-on-one someday. A trust at the highest level is just a contract you create. The person who creates it's called the grantor. That's, we'll say that's me in this situation. The person who puts the stuff into the settlor, usually the same person. It'd be great if people put their stuff in my trust, but that's not typically the way it happens. The trust has sort of a president. That's the trustee, the person who can actually write a check, sell the house, etc. And then finally it has beneficiaries, a lot like a will. After I've passed away, this is what goes where. In ours, we now have a likely heir that we've got my daughter, but we've got a piece that's going to create a fund and name at Ohio State for one of our dogs that's passed away. So there's some other kind of complications to it. That's the plot. Types of trusts, so there's, if you create it during your lifetime, we typically do living trusts in Ohio. That is a standalone document, it's not part of your will. Revocable types mean that you can make changes. So if we're avoiding probate, if we're trying to hold the money till your kids are old enough, that's the main type. If you have questions about long-term care, someone said something about I should use a trust to protect my house from Medicaid or something like that, that's typically an irrevocable trust. And again, we don't have a lot of time to get into the nuances there, but those are the main subsets here. And then, as I said, the main reasons we use them, the first big one is to benefit minor kids. Under Ohio law, if you do a will and your kids are young when you pass away, the court's going to hold the money for you. If you want access to the money, the guardian has to go to court and say, Judge, I want to buy the child a car or pay for private school, and the judge rules on the matter, so it gets really expensive and time-consuming. And then on their 18th birthday, they get a big check for whatever the amount is that's left in the account, almost always too young for them to inherit. So by and far, the number one reason we're doing trusts right now is say, let's hold it until my kids are 25 or 30 or 35 or some age that's a little more mature. Second is to protect privacy. Probate records are public record and they're all going online. So with Franklin County, if you want to know what the little old lady down the way had when she passed away, you shoot an email to the clerk and say, I want to see Mrs. Smith's estate, and that afternoon you get the whole file and you'll see who'd her will leave it to, was she broke, was she a millionaire, I bet she didn't leave it to Johnny, she never liked him. That's all outlined in public record. As I mentioned, I grew up in a smaller county, Wayne County, where people are really private. They don't like the notion that that's going to be public record and that you can get it online. Third is creditor protection. So if your beneficiaries might have credit issues, if you're worried that your son-in-law is not still going to be your son-in-law, or your kids are going to go through a bankruptcy, or that they could get sued because they're a doctor, if you leave their inheritance to them in a trust, it can't be taken by any of those types of events. And so anyone who's got concerns about their heirs, we do this. Sometimes it's because they're just bad with money. Maybe there's drug or alcohol problems. For any of those circumstances, we use trusts. If you have a child with special needs, it's really important that you can do a special needs trust nowadays. The old rule of thumb was if you've got 4 but one's disabled, we'll leave it to 3 and they'll take care of their brother. We don't have to do that anymore. You can do a special trust just for those individuals. Maybe there's some estate tax savings. As I mentioned, we're not going to get into it too much, but I will give you the limits for this year. And then finally, anything in a trust doesn't go through probate. So that whole complicated process I described, you can avoid that by putting your stuff into trust. Ohio estate tax. Anyone know if we have an estate tax right now? Answer is no. Governor Kasich helped repeal that. It's been gone since the start of 2013. Back when we had it, it used to affect almost everyone. So anyone that had an estate over $338,333 paid 6 cents of every dollar beyond that to Ohio. 7 cents of every dollar beyond $500,000. It's gone. I don't think DeWine's going to bring it back. I don't know who the next governor is. The federal estate tax, and this is where people will probably tune me out if they haven't yet. Currently, each one of you has an exemption of $11.4 million that you can leave wherever you'd like. If you're married, you can double that. If you have more money than that, please work with all of the professionals who are here tonight. We'd happily help you solve those problems. And then my top tips real quick, plan for your disability. At a minimum, get a will. If you got little ones, you got to put a nomination for a guardian. Make sure you're trustworthy, your executor's trustworthy. Don't just pick the oldest child, pick the best person for the job. If you don't have a will, Ohio's going to pick where your stuff goes. If you do have little ones, consider establishing a trust. The way you actually own your assets, the POD, the TOD, the beneficiaries is really important. Generally speaking, you shouldn't name your estate as that beneficiary. That's a pretty inefficient way to do things. You need to know what the tax laws are, and that is the effect the year you die. So those are this year's rules. Those of you hoping to die sometime in the future, we don't know those yet, so you need someone like Adam or me to tell you what the rules are, particularly when you get to a more certain time frame of this is probably within the next few years, or you have a diagnosis or something like that. And then finally, if you're going to give away more than the annual gift tax exemption, call a lawyer or an accountant to make sure that that's the right thing to do. I'm just going to breeze through this. I've been asked, you listed all the documents, who needs what? So for the various stages, if you're single, you probably want to consider the basics, the disability documents and a will. If you're married in a relationship, you should check those boxes off. You might start thinking about a trust depending on your professions and your net worth. By the time you've got a family, you should check that box. You might think about more long-term planning for a dynasty trust, or if you have a kid with special needs, you need to include that. If you make it to retirement, you should have checked those boxes, and then we can talk about whether we should start planning for Medicaid or veterans benefits, or whether a life insurance trust would make sense. People always ask, how often should you review your planning? We say every 3 to 5 years. For my clients, you get a letter on the 3rd, 6th, 9th anniversary just saying, let's sit down and make sure we pick the right people for the right jobs. At a minimum, every 5 years is pretty good. Anytime that one of these events occurs, they recommend seeing your lawyer. So if someone's died in the family, if there's been a divorce, you have some sort of diagnosis like a dementia, Alzheimer's, a general decline in health, or if it's been a new decade. Those are all typically good times. That's my contact info. It's also in the back of your packets. I think there's even a thing on there if you want to sit down and talk one-on-one, I'd be happy to do so. I think I'm allowed to answer a question or two at most. So if anyone has one, first person up, I'll take it. Free legal advice. So, or I'll get out unscathed. So, thanks.
Alrighty, so our next speaker is also your host for this evening, so I didn't think it was appropriate for him to introduce himself. But he started his career more than 18 years ago right here in Columbus, Ohio. He's a recipient of Columbus Business First 40 Under 40 Award, and was also named one of Business First Central Ohio's 20 People to Know in Finance. Financial Advisor magazine named him as one of only 8 portfolio managers to the Research All-Star team. Investopedia named him to their list of the top 100 most influential financial advisors in the U.S. Libertas Wealth Management Group has been named 5 times to Columbus CEO Magazine's Best of Business Awards as their top private wealth management firm. And we are still the only retirement planning firm in Central Ohio to receive the Better Business Bureau's top honor to their prestigious Torch Award for ethical enterprising. He's a certified financial planner and one of only 2,600 chartered market technicians in the world. It is my pleasure to introduce you to the founder and president of Libertas Wealth Management Group, and he's also technically my boss, so I have to say that. Adam Koos.
All right. That's good. Yeah. All right. Thanks, Zach. Before I move into my part of the presentation here, I just want to say real quick, I know that Jeff already mentioned how important it is to have your estate plan reviewed every 3 to 5 years. I can tell you, Zach could tell you, the #1 most procrastinated thing that we see in our office is estate planning. People just don't want to deal with it, and they just put it off and put it off, put it off, and then they run into an issue that maybe Gina would help with, and then we run into problems where things are too late. We can't do anything, and we're kind of stuck. So definitely, oh, and I didn't mention earlier, I believe that Jeff is also one of the youngest, if not the youngest partner ever at Carlisle, Patchen & Murphy, so it's important to have a young attorney who does your estate planning, right? Okay, so I mentioned earlier I'm a little long-winded. I'm sure that there's a line back there on the over-under of whether or not I'm going to make 20 minutes. Let's see if we can get through this. So I'm going to talk about retirement planning in the 2020s, so new age retirement planning. And I'm going to try and get through the sinus congestion. So our agenda today, what we're going to talk about is how to plan for a successful retirement for the people in the room who are not yet retired. Then we want to make sure we don't run out of money in retirement. We're going to talk about how much risk we should take when it comes to our investments, how to protect our retirement savings from recessions, and then what do I do if you need help? And I think you know where that's going, right? So first, let's talk briefly about what do we do to plan for retirement? You know, how do we plan for a successful retirement? Going back to procrastination, kind of like estate planning, retirement planning is number 2. It's the number 2 thing that we see people procrastinate on. They don't want to deal with this stuff. Woody Allen said, I'm not afraid to die, I just don't want to be there when it happens. You know, put it off, put it off. No laughs, really? Nothing. No. Tough crowd. All right, Dan, when Social Security gets up here, you know you guys are in trouble, right? So you need to have a checklist of things available, and probably the first thing you need to do is just get organized. Investment statements, so 401ks, 403bs, IRAs, insurance statements like your life, long-term care, health insurance, disability insurance. Jeff was talking about trusts, wills, POAs, healthcare directives. Your retirement income statement, so we're talking about the income you're going to get when you retire, like STRS, PERS, SERS, private pensions. Property values for illiquid assets. Property values for out-of-state assets, that's really important. And of course, any inheritances, which isn't up here. And then of course, most recent tax returns. You know, we want to look at all these things and kind of gather an inventory of what you have, what you spend, and what you make, not only now, but in the future. Next thing we want to do is we want to find out what you spend. So we talked about gathering an inventory. Well, this is our expense sheet, and trust me, nobody wants to fill it out. But we want our clients to fill something out that tells us in today's dollars, so for those of you who are not retired, we want to know in today's dollars, if you were to retire tomorrow, how much would you spend on all these things if you were to quit? The kids are gone, you're not driving to work and back anymore, so how much am I going to spend? Now, if you're already retired, then we just want to know what you're spending now. It's really simple. So once we have that all filled out, we can then adjust it for inflation. Very simple. We just use software. Now, how do we make sure we don't run out of money in retirement once we retire? Well, first of all, we all have this plan, right? We're going to work, make money. If we had kids, we're going to take care of the kids, send them to college. They're going to graduate from college. We're going to save some more money. Then we're going to retire, and we're going to have this nice, easy path to the checkered line, right? But actually, reality, there's all these other things, right? There's health concerns that come up. There's market crashes, you know, things that kind of put a dent in our portfolios. So what we do at our office is we calculate retirement success using 2 different types of calculations, and the most important one's what's called a Monte Carlo analysis. How many people in the room, by the show of hands, have ever heard of what a Monte Carlo is? 1, 2, 3. Okay, quite a few. Good. So what a Monte Carlo is, for the people that don't know, is it takes 1,000, literally 1,000 snapshots, or trials we call them, of actual market history, or it's throwing different trials and different situations at your portfolio, as opposed to saying, well, I think I'm going to make 4% per year, or I think I'm going to make 6% per year, and instead of just saying 6%, 6%, 6%, 6%, because that's not how portfolios grow, right? I think we all know that. What it does is it throws, you know, we made 12% one year. We lost 6% one year. We made 3% one year. Another year we made nothing. Then there was a market crash and we lost 20%. So it throws all these different scenarios at your retirement plan, and it comes up with a probability of success. We want our clients, depending on their age, to be somewhere between 70 to 75 and call it 80 to 85%, again, depending on their age. What that 95, this is a real financial plan, by the way, one of our clients. I blurred out all the details, but the 95% says basically that 950 out of 1,000 trials were successful. So we have a really, really high probability in this client's case of getting from now to the day they die, in this case at 92 years of age, without any problems whatsoever. Now, there is no such thing as 100%. There's your alien invasions, nuclear wars, zombie apocalypse, you name it. So you cannot have a 100% success rate because of the apocalypse du jour or black swan events. And then once we build that financial plan, we know how much you're going to spend, how much do you have saved, what's your income sources, and we adjust everything for inflation. Then something we like to do, and this is going to sound a little strange, we like to purposely break the plan. So I'm going to say that one more time. We want to break your financial plan to see how bad can it get. In other words, we call it a stress test, to see how much more could we spend. So if you look down at the bottom here, we have retiring at 63, 59, but we have $69,000 in expenses per year instead of 56, 57. So this was just one example, but we can change vacation expenses. We can change how much we're going to sell our home for when we downsize, let's just say. We can change how much we're going to spend on our kids' or grandkids' wedding or helping with the kids' grandkids' college savings, things of that nature. But the reason why we want to stress test it is we want to see how many mistakes could we make before this thing breaks. And then that way we know how much more we could spend than, say, perfection in this case. One of the things we say at our office behind the scenes, we don't like to share this too often, but we say that one of the single biggest reasons that clients fire their financial advisor is lack of communication. The single biggest reason clients fail in retirement planning is because the client doesn't follow the plan. So once we have a plan in place and we've stress tested it, we've broken the plan, we know what we can do, we know what we can't do, we just got to follow the plan. There's going to be things that freak us out, right? There's going to be Trump tweeting. There's going to be, there's going to be North Korea, testing missiles over the Pacific Ocean. These things are going to happen. And if you think back in your life, by the way, if you think back to the 80s and the Cuban Missile Crisis or the oil embargo, people lining up and looking at their license plates to determine whether or not they could get gas that day. I mean, these things happened a long time ago, and I think we're okay now. We're all sitting here having pretty good food, the bar's open. So just follow the plan is the story here. So once we build that plan, we have to follow it. If we don't follow it, then we're going to fail. Now, the next piece here is talking about how much risk we should take. This is kind of a loaded question because at our office, we do things a little differently. If you've been to a financial advisory office at some point in your life, you've probably taken one of these risk tolerance questionnaires where you answer 10 questions and it says this is the kind of portfolio you should invest your money in. Now, we still think that's important, but we don't think it's important for the sake of determining how we invest your money. We think it's important to understand the behavioral psychology of all of our clients so we know how they can handle the ups and downs and the volatility of the markets. So when we determine how much risk our clients should take, we look at the output of their financial plan. What we just looked at a second ago, if that financial plan says we need to earn 6% per year from now to the day you die, but your risk tolerance questionnaire says that you're only comfortable taking risk to earn 4, we need to have a discussion because we want to give you what you need, not what you want. And there's a huge difference sometimes. Now, in most cases, everything's fine. Somebody fills out a questionnaire and we say, okay, well, they're right in the portfolio. They should be both from a behavioral standpoint and their financial plan agrees with it. So there's no problems. But every once in a while, and I always tell the same story, there's somebody who will come in the office who will say, here are all my goals, here's all my income, here's all my assets, here's what I'm spending, and I'd like to retire in 2 years. And by the way, I hate stocks, I hate real estate, I just like bonds and safe stuff. And when we do the plan, we find out that they're going to go broke safely, is what we like to say, because they won't make enough to keep up with their standard of living. So in that case, when we do this risk tolerance questionnaire, which is basically what it does is it creates a speed limit that tells you how fast you metaphorically drive your retirement vehicle. And we want to make sure that speed limit either A, aligns with the financial plan, or if it doesn't, that we have a very serious discussion about making sure we understand why we have to maybe drive slower or drive faster. Now, if anybody here in the room wants to do one of these speed limit questionnaires, it's on our website, it's free. All you have to do is go to the bottom of the website, click on the free portfolio risk analysis. It's going to pop up a new page. Once the new page pops up, you click on Get Started, then it's going to ask you for your contact information. You can answer a bunch of questions, and then you're good to go. Now, when you're done, depending on where you fall at our office, we have 4 different model portfolios, and depending on what the market's doing at any given point determines how aggressive we're being. So just looking at the aggressive portfolio here, when the market's on offense and things look great and we're trending up, we're driving at 88 miles an hour. We're driving a Ferrari. Now, when the market looks trendless in that portfolio, we take our foot off the gas and we coast. And when the market starts to crash and it looks like the sky is falling, then we just put the brakes on, pull over underneath the bridge while we have whiteout conditions because it's just not worth taking the risk anymore. And you can see our conservative portfolio or conservative model is even more conservative. In other words, it can't get much more aggressive than 48 miles per hour. And then it's more conservative when we're on defense. So moving on, to kind of close out here, how do I protect my retirement savings from recessions? The average market crash occurs every 7 years. The average crash is 42%. That means half are better and half are worse. The last crash took place more than 10 years ago, about 10 and a half years ago. So at some point here, we're going to see a market crash. I don't think it's coming in the next few months, but at some point it's going to happen. And I think it's so important to understand what the break even is and how much more important it is to avoid losses than it is to capture gains or to shoot the lights out. As the saying goes, the joy of winning doesn't feel quite as good as the pain of losing. And so when we lose, let's just say 30% of our portfolio value, we have to make 43% just to break even. If we lose 50%, we have to make 100% to break even. You can see how bad this gets. You lose 60, you got to make 150% to break even. And then here is the worst decline or market crash by decade going back to the Great Depression. And you can see here, if you look at the 50s, only a 20% decline, 21. The 90s, 1998, the worst decline was 19.9%. And this decade is over in 3 months, in a couple days here. And this decade is going to end with the worst decline at only 19.9%. And there was actually 2 times, 2011 and last fall. That's it. So everything reverts to the mean. I'm not trying to fearmonger here, but I think at some point we have to be cognizant of the fact that humans suffer from a little thing called recency bias. We tend to remember more favorably what's happened in the recent past and forget about how bad things can get. So I think we need to make sure that we're prepared for things like this. So how do we help our clients prepare for recessions? We use something called trend following. And I'm going to keep this super high level on purpose. Trend following is a lot like predicting the weather. When the sky is sunny, that's like a nice, big, healthy uptrend. There's really nothing to worry about, and we can just ride that hill all the way up. It's awesome. You know, this is the 90s. 1998 was the only decline right here, and that was the only time that we would have gotten out of the market. We would have gotten out low. We would have had to pay higher prices to get back in, and that's okay, because it's like insurance. It's like, we like to think of, when I say it's like weather, we like to think of it like tornado sirens. So when a tornado siren goes off at your home, you probably go to the basement. At least most people I talk to, they go to the basement. Now, if you go to the basement, what are the chances you're actually going to see a tornado? Pretty small, right? And usually there's no tornado. So what you're left with is just being annoyed that you're behind on the game or you're behind on your show you're watching. Now your friend's texting you and saying, hey, can you believe that happened? You're like, wait a minute, I went to the basement, you know? So when we have tornado sirens, we have to go to the basement. And it's the same way with the market. When all the signs go up, when all the red flags go up, that the market looks like it's going to crash, it's like the tornado sirens going off. So trend following works in uptrends. It also works in downtrends. This is 2007, 8, and 9. We just want to go to the basement in case we see a tornado. Where things don't work so well with our strategy or with trend following are during times when there is no tornado. There's a siren, but the tornado never quite shows up, kind of like real life. In 2015-16, there was 2 of those. In 2018, just last year, there was 1 of them. And there's been 12 in the last 25 years. So in other words, about once every 2 years, there's a tornado siren, and in only 18% of those cases is there actually a tornado. But the problem is that avoiding losing half of your money is so worth it for that insurance, so to speak, or to go to the basement. In the long run, it pays to be more conservative. And here's those 12, these rose-colored areas are the 12 tornado sirens that have taken place over the last 25 years. And you can see there's lots of times where tornado siren went off, no tornado. But here in 2000, 2001, 2002, right here, 2007, 8, and 9. And then since then, we've had nothing but false alarms. That's it, false tornado sirens since then. But who knows what will happen in the future, right? So, and the reason we do things this way is because diversification, it works really well in up markets. So it works until it doesn't, right? So here's diversification in an up market, looks great. Here's what diversification looks like when the market's crashing. Everything correlates, everything goes down, you can't really hide. Even right here, this little downtick in bonds was a 2-month period where bonds went down 18%. It's relatively so small relative to the stock market that you can't even see it on the chart. So, what do I do if I need help? First, hire a fee-only firm. We're a fee-only fiduciary. It's extremely important, in my opinion, to make sure you're hiring a financial advisory firm that cannot get paid commissions, that is not going to sell you an annuity that's going to have this big penalty to get out of it. You know, in other words, you want to be, even the annuities that we offer our clients don't have penalties. So in short, you want to hire a fiduciary. That's kind of been a big word this past 4 or 5 years. Second, you want to hire a company that has certified financial planners working there. Zach and I are both CFPs. Certified financial planners have done 2 years of subsequent coursework after college. They have to pass a 7-hour exam. There's all this continuing education that we have to do, and we have to stay on top of regulations and changes in the industry. And then you got to get educated. So obviously you're all doing that by being here today. So get a second opinion on your financial plan. Interview a fee-only fiduciary. If it's not us, there's a website out there called NAPFA, the National Association of Personal Financial Advisors, where you type in your zip code and you can see all the fee-only advisors near you. And then, of course, ask questions. I think too many times people are afraid to ask questions because this stuff's not easy. It's kind of complicated. So it's easy to kind of want to cower down and not say anything when, questions are welcome. So to close out here, just a quick quote. Retirement is the longest vacation our clients will ever take. No one would take a trip across the country in a car with the gas pedal constantly pressed all the way down to the floor without the entire trip. Rather, there are times when you need to slow down, stop, or even reverse progress depending on the weather and driving conditions. And the same can be said for your retirement plan and investment strategy. We want to make this process easy for you, all while mitigating as much stress as possible along the way. So I'll just take one or two questions, if there are any, that is. You make this easy for me too. It's you, Jeff, it's you and I, no questions. All right, so let me move on then and introduce Dan. It's just why everybody's here, right? Talk to the Social Security guy. So Dan is the staff assistant and state liaison for the Social Security Administration in the Columbus Metro and surrounding areas. He began his career with Social Security in 2005 as a claims representative, shortly after graduating from The Ohio State University with a bachelor's in economics. Dan's time as a claims rep and operations supervisor has helped him gain knowledge in all Social Security programs and benefits, including retirement, disability, Medicare, and supplemental security income. As the staff assistant state liaison, Dan acts as a Social Security liaison between local and state organizations and as a public educator. Committed to educating others about Social Security's programs and benefits, he frequently gives presentations to a wide variety of audiences and can often be found staffing a Social Security booth at one of the many fairs, exhibits, and professional conferences throughout the area. And I think I'm really excited. We've had one time we've done an event like this, and I just think it's always so great to have somebody from the Social Security Administration here to speak and take questions. So when Dan's done, there's no limit to questions. You can ask as many as you want. But if you please put your hands together for Dan.
All right. Thanks, Adam. All right, well, good evening, everyone. So my name is Dan Demchesky. I'm with Social Security. I work out of the downtown office in the federal building. So I'm going to bring us home tonight with the Retirement 101 for Social Security here. So we're going to do an overview of retirement benefits. We're going to talk about how work can affect benefits. We'll touch on how to file for benefits, and I'll finally wrap up with My Social Security, which is a really important tool if you haven't used it yet. So to qualify for a benefit for Social Security, you have to work a minimum of 10 years or get 40 quarters of coverage to be vested for a benefit. So I like to tell folks you can work 10 years in your 20s and 30s, never work again, come back when you're at least age 62, you have your 10 years, 40 credits, you're vested for a benefit, your foot's in the door. Now granted, if you only work 10 years, it's not going to be a huge amount of money, but that's what you need, the minimum amount to get into the door. So every year you can earn up to 4 credits. So this year in 2019, that's $1,360 in earnings will get you 1 credit for this year. So to get all 4 credits for this year in 2019, that's $5,440. So it's not a big threshold. Generally, part-time work will get folks over those thresholds. So you just need 10 years of that type of work through your lifetime. Now, the way we determine your benefit is a lot of folks have misconceptions about how we compute the benefit for Social Security. And the way we determine this is we take every single year of work you paid into Social Security, so going back to when you're in high school, if you worked then, up until now, and we index every single year for inflation. So something you made in the 70s, 80s, 90s, we bring it to 2019 dollars, so you're not negated by inflation. And then we cherry pick the highest 35 years of your work through your lifetime. So it doesn't matter when you made it, just the highest 35. And we get an average of what you made per month. And essentially, without pulling you through the mud and making you go to math class, we get a percentage of what you made per month over those 35 years, and that's what you get back on Social Security. So it was never intended to be the whole kit and caboodle for retirement. It was never intended to be the whole, pension plan. As you may have heard before, there used to be pension, Social Security, and savings, the kind of that 3-legged retirement stool. And as we know, the whole retirement planning strategy has changed as time has gone on with 401ks, IRAs. Social Security, we've had some tweaks along the way, but it hasn't really changed for the whole income retirement landscape as that's the way it's gone. So again, just kind of in a nutshell, 35 years, get an average what you made per month, plug it into a formula, you get a percentage back on that. So there is a relationship between lifetime earnings and how much you get out of Social Security. So what that means is if you are a higher income earner, you will get a higher benefit per month than everyone else, lower income earners, but you will get less percentage-wise of what you paid into it compared to middle income or lower income earners. The thinking here is if you are a higher income earner, you probably have access to maybe a 401k or a pension or your own savings set aside, compared to the middle income worker or the lower income worker who maybe is working minimum wage. Someone working minimum wage probably doesn't have access to a 401k or a pension, probably doesn't have a whole lot of savings because they may have been working paycheck to paycheck. So the person at the bottom of the income scale will actually get a higher percentage back on what they paid into Social Security. Again, the thinking being here is if you're a lower income worker, you probably don't have a whole lot else to get you through retirement. So we're going to help that person replace more of their income into retirement. And if you talk to financial advisors like Adam, you may even hear percentages. Try to replace a certain percent of your income depending on what your lifestyle choices are going to be, what your expected longevity is going to be, health, all these different factors. Just kind of baseline you here, try to replace 70% or even 80% if you just go out there and Google on the internet. So Social Security is going to replace part of that. Again, never intended to be the whole picture for retirement. So this next slide here kind of illustrates that, gives you a few examples. So at the top here, we have a lower income worker making an average about $18,000, $19,000 a year. That worker at their full retirement age will get a little bit shy of $1,000 a month from Social Security, and that's going to replace about 61% of that worker's pre-retirement income. A middle income worker here making an average about $42,000 a year. That person can expect a little bit shy of $1,600 a month from Social Security, and that's going to replace about 45% of that worker's pre-retirement income. That's about average. So you're looking at 40-45% is what the average beneficiary gets replaced through Social Security if they take benefits at full retirement age. If you take it earlier, beware, it's going to be reduced, and I'll touch on that in a second. And there also is a maximum benefit. So because there is a maximum taxable number every year for Social Security in your income, there's also a maximum benefit. So that's about $2,800 this year in 2019. That does go up a little bit every year, but that's the maximum benefit if you were full age taking your benefit now. Now we get asked a lot, what is the best age to claim Social Security? And I really wish I had a one-size-fits-all answer because there's a lot of factors and varieties that go into this. But just know that you have options. So we don't really tell anybody this is the best time to take it. We're not financial advisors at Social Security. All we can really do is give you the big picture. We can give you a nice little spreadsheet telling you this is your benefit now versus later versus beyond if you delayed taking benefits. So on this slide here, we have an example of a person who would take their full benefit if they waited till 66. Full retirement age, they would get $1,000 using round numbers. They can take benefits earlier, as you can see, if they take it as early as age 62. However, if you take it earlier, you're taking a reduced benefit. So that's the trade-off. If you take benefits earlier, you're getting less money per month to get more checks out of the system. So that's a permanent reduction. The only thing that would increase it are one of two things. Cost of living adjustments, which typically are going to be announced October, November, so we'll find out pretty soon here if there's going to be one for next year in 2020, which I anticipate there will be, just a matter of what's the number going to be. And the second thing that could increase it would be if you're continuing working into the system, and let's say one of your latter years of work is one of the highest in your lifetime, one of those high 35, that could in turn drop out a lower year, bump up your benefit the following year. But if you take a benefit earlier, again, just beware, your benefit's kind of going to be locked in there. On the flip side, you can delay benefits after full age and get credits for delaying it. So this is something that some folks, if they can do it, they do it. You get an 8% bump in your benefit for every full year that you delay it after full retirement age. And the latest you can delay it is up until 70. So if your goal is to maximize Social Security, by all means go right ahead and wait till 70, but don't wait past 70 because at that point these credits stop. You're not getting any more money for waiting till 71 or 72. 70 is the absolute latest you want to wait if that's your goal is to maximize, all benefits out of Social Security. And as you can see, you can take it anywhere in between as well. It's just going to vary. We used to send everyone a yearly statement. You probably recall we sent them a couple months before your birthday telling you this is your benefit estimate. That statement didn't really give you the in-betweens, like what if I took it at 63 or 64 or 65. The way to get that information is on our website. We have a really good retirement estimator. It does not require an account. You just go on there, plug in some identifying information like your name, social, date of birth, and then what you can do is go in there and do some scenarios like what if I retired at 64 in 2 months compared to 64 in 8 months? What's the difference in my benefit going to look like? That'll let you do that. That statement that we used to send you doesn't tell you. So the full retirement age for most folks now is age 66. So if you're born between 1943 and 1954, the full age is 66. However, if you're born after 54, so between 55 and 59, as you can see on the slide here, the full age is going up. It's going to be 66 in a few months depending on the year you're born. And everyone born after 1960 or later is going to have a full retirement age of 67 now. So this is not a recent change. I was in my diapers when this was changed in Congress. So a lot of folks just, I understand it. You're younger, you're not thinking about retirement. It's way away for me. I'm not even looking into it. When I get there, I'm thinking 65. Well, beware. It's now 66 or 67 depending on when you're born. Now, even though the full retirement age has gone up, the early age of 62 is still there for everyone. So that has not changed. The only difference now is you have bigger gaps between those two ages. So that means there's bigger reductions if you take the benefit at age 62 and your full age is now 67. So if I take my benefit at age 62, I'm looking at 30% reduction in benefits compared to folks that are 62 a few years ago, they would have got 25% reduction. So that's one of the things when you hear talks about changing the full retirement age, this is one of the things that kind of helps shore up things for our finances for longevity. So as I mentioned, we have the retirement estimator. This is a really good tool. You don't have an account to do this. You just go in there, plug in some basic information. However, I would say just if you're a person who has a non-covered pension from Social Security, that means you work for the state, city, county, school district, you're paying into these public pension system here in Ohio that do not pay into Social Security. Your benefit might have to be computed with a different formula. You may have heard of this, it's called the windfall or the WEP. This calculator will not factor that in because we have no idea how much your pension is going to be from that OPERS, STRS, STRS, whatever that pension source may be that was not paid into Social Security. So just be aware, take that number with a grain of salt if that's your situation, if you have a pension not paid into Social Security. But for everyone else, this is a really good tool to use to get a starting point, just to get a feel for what the numbers look like. So we get asked a lot, can you work and receive benefits? And the answer is yes. However, if you take benefits early, so that means prior to full retirement age, that's 62, 63, 64, 65, just be aware there's a limit how much you can work and earn and still receive your benefit without it being affected. Because if you're coming into 63 and saying, I want to take benefits, I'm retired now, well, by all means, go right ahead and take it. But if you're going to go back to work, you got to be aware of this because this is going to apply until your full retirement age. And these figures change yearly, so next year in 2020, it's going to be probably a different figure, probably closer to 18,000 for that first figure there. But this year in 2019, the limit is $17,640. So the way that works is if you're working and earning wages, you can make up to that amount in gross wages, and there's no effect on your Social Security. So we'll still pay your benefits even if you're making, $15,000 a year, possibly working part-time. But I'll take a question at the end here. So if you go over that limit, for every $2 you're over that, we have to withhold $1 in benefits. So if you make, for example, $10,000 over that, we're going to hold $5,000 in benefits. Now, the thing is here, we have no idea how much you're making in real time. We don't get live wage reports from the IRS or your employers. We get W-2s the following year after taxes are done. So if you file for benefits and you're going to go over these thresholds, my key to you is let us know about that. If you're going to go over these limits, then we can hold the benefits ahead of time to avoid any kind of overpayment, just because it can be a headache if you go back to work, forget to tell us, you go over these thresholds, we find out the following year once we get your W-2 from the IRS, and then oops, we got to send you a letter saying we paid you X amount of dollars, let's figure it out how you're going to pay it back to us. And the year that you attain your full retirement age, the limit goes up much higher. So it goes from that $17,640 up to $46,920. And that's only in the months prior to your full retirement age. So just use myself as an example. My birthday's in the month of July, so that's when I would turn 67. That limit would apply for me for January through June. And then once I attain full retirement age, these limits go away. So once you're past your full retirement age, you don't have to worry about this anymore. This is just for folks that are taking benefits early, prior to full retirement age, and they go back to work. After full age, you're allowed to work as much as you want. If you work full-time, part-time, do whatever you like, they will have no repercussions on your benefits, essentially. Now, what we count towards these limits is wages from work. So if you're working for an employer, whatever shows up on your W-2 for your gross wages, or if you're self-employed, your net taxable earnings is what we're going to count. We're not going to count any other pensions, IRAs, 401ks, inheritances. We're not going to count your Social Security benefits. So those things obviously have income tax obligations. But for this rule alone, we're just looking at what you're making from wages from work or if you're self-employed. So just a quick note about disability benefits and retirement. You can file for both disability and retirement if you are prior to your full retirement age. So we see this quite frequently where folks will come in and we'll talk to them in the course of the conversation while they're filing a benefit application. And they'll say, I'm filing for benefits now, I'm 62, I want to take my retirement. And they're not working anymore, and we'll kind of just probe, why aren't you working anymore? Did something happen? I can't do it anymore, my back's hurting, I just don't have the chops to do what I did anymore. I was doing really physical work, so I'm taking my benefits now just because I physically can't do the work anymore. In that situation, we would actually tell the individual it might behoove you to file for both retirement and disability because you're not working, so we can go ahead and pay you retirement because you're over 62. But on the back end, we could possibly approve you for disability benefits, which will result to you getting a higher benefit if we can find you medically disabled through Social Security's disability program. So in those folks, we tell them, if you're not working or if you're making below substantial gainful activity limits, which this year is $1,220 a month, then you can go ahead and apply for both retirement and disability. Disability can take some time, as you may know. It takes months to get a decision back for disability, but we can pay that person their retirement benefit while that's going on. That's only going to apply up until the person's full retirement age. After full retirement age, if you become disabled, the benefits for disability and retirement are exactly the same. So in that case, there's no point to go through the whole process of filing for disability. We would just have that person apply for retirement instead because it's, again, the same benefit with a lot less stipulations. So we have benefits for dependent spouses. So a dependent spouse is someone who had basically paid not enough into Social Security or paid very little into Social Security. So they could potentially get a benefit off of a higher wage earner in the household that they were married to or possibly even an ex-spouse. Now, if you had a spouse who did not pay into Social Security but they paid into a separate pension system, like here in Ohio we have OPERS, STRS, SCRS, Ohio Police and Fire, Civil Service Retirement System. These are folks that did not pay into Social Security, so it's kind of a substitute for Social Security. They may not get a spousal benefit because they have income just coming from a different stream. So we'll show an example of what that looks like here in a second. So spousal benefits are limited to 50% of the higher wage earner's benefit. You can take this benefit earlier, just like your early retirement benefit at 62. However, it's going to be reduced for age. So you're not going to get the full 50% if you took that benefit earlier. But if you want the full 50%, you have to wait to either your full age or there's some stipulations you could take it even earlier if you are caring for a minor child. And these benefits do not reduce the payment to the higher wage earner. So if my spouse were to claim benefits off of me as the lower wage earner, I do not lose a dime by her claiming that spousal benefit. So when you apply for benefits for Social Security, we ask a lot of probing questions. Who are you married to now? Did you have any previous marriages? Do you have any minor children, any disabled children? So a lot of folks think we're just being nosy, and the reason why is to determine, is there other benefits possibly due to you, this being one of them. So benefits, again, for spousal benefits can be up to 50% at full age. However, if you take it earlier, then it's going to be reduced, just like a regular retired person if they took a benefit at age 62. So this slide here kind of shows that if you took the benefit at age 62, you're looking at roughly 35% instead of 50% of the higher wage earner's benefit. Again, the exception here being if you are caring for a minor child who is under the age of 16 or a child who is found to be medically disabled through Social Security before they turn age 22. Those are the kind of the two exceptions to that rule, that you could get the full 50% regardless of your age if you're either caring for a minor child or caring for a disabled child. So we also have benefits for divorced spouses. So to be eligible as a divorced spouse, you got to be at least age 62. You got to be unmarried. Your own benefit has to be less than half of your ex-spouse's benefit. So a lot of times if you've been divorced for many years and you're not really sure, you can contact your local office if you know your ex-spouse's name, social, not even their social, if you know their name, date of birth, identifying information. We can generally look it up and determine if there's benefits possibly due to you off of your ex-spouse. And the big qualifier here is you have to be married at least 10 years to your ex-spouse. So if you got married, then you got divorced 9 years and 6 months later, I'm sorry, you should have prolonged those proceedings to 10 years. So that's the cutoff that Congress created for the divorced spouse benefit. But divorced spouse benefits do not reduce a dime to the ex-spouse. So if it was a really messy divorce and you're worried that you're going to get some fallout for you claiming an ex-spouse benefit, your ex-spouse does not lose a dime by you claiming or vice versa. So it's just additional money we can pay out if you were married at least 10 years, again, have a lower benefit on your own work history. So let's do a typical spousal benefit computation. So we have Fred and Alice. They both paid FICA taxes, which means they paid Social Security and Medicare taxes. So Fred was the higher wage earner. His full benefit at full age is $1,600. Alice's benefit at her own full age is $1,000. So as we mentioned, the spousal benefit is the 50% of the higher wage earner's benefit. So Fred was the higher wage earner, so half of his benefit, $800. Because Alice's own benefit, that own $1,000, is higher than $800, she just gets her own money. So she's not going to get a dime from Fred while he's still living. It's different when a person passes away. It's a completely different ballgame for survivors. But for a living spouse, we're just going to pay you whatever's higher, whether it's your own or if you're due more off of your living spouse. So in this case, we don't recognize her as being dependent upon him because her own contributions into Social Security are greater than that. Now let's throw Alice's Social Security out the window. She didn't work for Social Security, she worked for the school retirement system, and she gets a teacher's retirement pension. If she has a pretty high teacher pension, she likely will also not get a benefit from FRED. So there's some caveats to that, but if that's your situation, check with us. We can tell you for sure if there's possibly a spousal benefit due to you, or vice versa, if your spousal benefit due off of your own work history. So when it comes to filing for benefits, there's a few different avenues. The quickest way I would say is filing online on our website, ssa.gov. Don't go to ssa.com or any other place. There are some fraudster websites out there just trying to siphon information from folks, so make sure you go to the official website, ssa.gov or socialsecurity.gov, so make sure you see .gov at the end there. You can file for currently retirement benefits, Medicare benefits, disability benefits. The only benefit you cannot file for online right now is survivor's benefits. So if you're going to be filing for a survivor in the event a spouse passing away, for that, contact a local office. You can make an appointment. Don't recommend walking into the office. If you're here in Columbus, you've probably been to the office before and you've seen it can be kind of a zoo. So I recommend if you're going to file for benefits with the local office, whether it's in the office or over the phone, just call ahead, make an appointment. That way we can dedicate a person, date, and time to talk to you. And you're not having to wait in our lobby for a couple hours just to be told, I'm sorry, we're jam-packed today, we don't even available. Here's an appointment, come back in a few weeks. So especially just go out ahead of that. So our local office hours are Monday, Tuesday, Thursday, Friday from 9 a.m. until 4 p.m. Wednesday is our short day. So Wednesdays we close the doors at noon, and we also turn off the local office hours on the telephone at noon. The reason being is, as Matt mentioned earlier, there's 10,000 folks retiring every day or turning 65 every day. So we have record numbers of folks coming into our lobbies, our doors, filing online for applications and benefits, and we've kind of lost several thousand employees over the last decade. It hasn't been the greatest decade when it comes to staffing for us. And our technology is kind of limping along. It's not 21st century stuff yet, I would say. So that's the reality, is we have a lot of applications to process. So Wednesday, our focus is to get applications for folks that are due the benefits now processed that day. So that's kind of the whole goal with Wednesday afternoons being kind of quiet time around the office. Now, we still have a national 800 number that's open from 7 a.m. till 7 p.m. at 800-772-1213. So you can still reach us Wednesday afternoons. You're just not going to get the local office. So last thing I'll touch on is My Social Security. Just by a quick show of hands, who here has a My Social Security account set up? Okay, good. So for the rest of you, this is kind of my homework to you. If you have not set your account up, this is what you want to do. Go to the MySSA portal. It's on our website. So it's kind of like creating an account anywhere else. You're going to pick a username, password. You're going to give an email address. So that way you can do a password reset if you needed to. And it's going to ask what we call out-of-wallet questions. So it's going to ask kind of really specific questions. You know, which bank was your mortgage through? Where was your car loan through? Where did you reside 20 years ago? So there are questions that if I just lost my ID and social number, they're not going to know these personal details of my life, hopefully, right? So a fraudster kind of gets tripped up on these things. That's the whole intention of that. So once you're in there, into the MySSA portal, you have some really neat features that you can use here. So if you're not receiving benefits, the main thing you can see is that statement that we used to mail to you. So we used to mail these statements every year, a couple months before your birthday. Now they're online. So that's the way to get to that statement, to see your most recent statement. So I recommend checking that at least once a year, just making sure that your earnings are being posted. You don't want to go years and years without looking at that. And then you come into our doors, file for benefits, and then we look back at your earnings history, and we determined back in '85 there was missing earnings and we didn't get reported from your employer. It's really difficult to reconstruct these earnings that are missing to find a W-2, because most folks don't keep records that long. So it's just a good idea to check that once a year, make sure it's correct. If something's wrong, bring it to our attention and we can fix it for you. Other things you can do if you need to get off a letter that you're not receiving benefits, you can print that off from here. In some states, you can replace your Medicare or your Social Security card through this as well. So we're not yet there for Ohio. We're working on getting that done. So my hope is maybe end of this year, if not this year, early next year, we'll have that available, that if you need to replace your Social Security card and you're not changing your name, you just need to get a replacement of what was on there before, you can log into your account, plug in your ID information, we'll verify it with the BMV, and then boom, the card comes to you in the mail without having to step foot in the office. So it's a really quick, simple process. So we're hoping to get that set up for Ohio residents here pretty soon, because I would say at least half the folks that come into our lobby, they're there just for that. That's a quick, easy transaction, but we have so many folks coming in, it slows everything else down. So that'll be a really good time saver for everyone when we get that pretty soon. Now, if you're receiving benefits, there's a whole lot more you can do here. You can update your address, telephone number, direct deposit. You can pull up copies of letters that we sent to you. You can see your benefit history. If you need to replace your Medicare card, you can do it from here as well. If you need to get 1099 when it comes to tax time, you can also replace it from here as well. More and more is being added to this. So it's really going to behoove you, when you're getting into the Social Security world, to file for benefits, to have this set up, because it's going to be a really, really useful feature. So everyone asks, what is the future with Social Security? Isn't it broke? Is it going to be there tomorrow? So I'll kind of give you the laydown of what the reality is with Social Security. So for many, many years, the boomers, when they're working and paying into the system, we had excess money coming into the system. So that's what we call the trust fund. So we're not like a pension system where we can invest it into stocks and bonds and stuff like that. We can essentially put it into government bonds. So many years we took in excess money, and that's where the trust fund was going into government bonds. Now it's kind of changed that the boomers are exiting the workforce, they're claiming benefits. So now it's got to the point where we don't have enough money coming into the system to cover all of our obligations. So now we're drawing on those trust funds. Now we're cashing in those bonds to shore up everything to make sure everyone's getting their full obligated benefit. So our actuary estimates we have enough money in that trust fund, these government bonds, to pay full benefits for another 15 years. So in 2034 is when we anticipate that trust fund will be exhausted if nothing changes. So this is like Congress sitting on its hands. Nobody makes any changes. We just kind of go on coast. We're coasting on to 2034. We'll pay full benefits for another 15 years. 2034 comes around. If nothing has changed, obviously there's still people paying into the system, but it's not going to be enough to cover every single beneficiary's benefit that's due to them. So at that point, we estimate we can only pay 78 or 79% of benefits at that time. And again, that's if nothing changes. So that means there is time to make changes. Ultimately, it's going to be up to Congress and the president to decide what these changes are going to look like. I wish I had a crystal ball to tell you what it's going to be and how to plan, but no one knows. So that's just kind of where we're at. That's the reality of what the future of Social Security looks like until, again, something changes. And I'm sure when that happens, everyone's going to be hearing about it. Some people will be pissed off. Some people will be happy about it. But obviously, no one can be completely happy about anything that happens in Congress. So we're at the end here. Any questions for me? Yeah.
My husband and I both, he gets PERS, I get SERS, and we both have enough credits to get Social Security. I know from your website that we can't figure out, do we contact PERS for Social Security to find out what the WEP is?
Sure. So her question was, both her and her spouse, they paid into Social Security, but they also have a pension outside of Social Security, like PERS, that's not covered by us. So to get the estimate of what your benefit's going to be, you would contact your local office. So I don't even call the national 800 number because you may get someone in a different state, and that windfall rule, only about 12 or 13 states are affected by that because, for example, let's say if you worked in Michigan, you would pay both into Social Security plus your state pension system, and you wouldn't have this whole mess of the modified formula with the WEP. So call your local office. If you have an estimate of what your pension is going to be for MOPRs, then we can get a better idea of what your benefit's going to be after all that's applied.
And then
you don't need an appointment. You can just call us. I would say just call us, yeah. Was there a question back there earlier?
Yeah, it's more of an addition. I think you described that if you keep working after you've collected Social Security and you have an employment and they take away $1 for every $2 you make, they also give that back to you when you do quit. But all the money they took from you, you do get back. But what is the schedule for that?
Sure. So
how do they add that to your monthly normal payment? How do they catch up? Is it 1 year lump sum? Is it
sure.
$100 a month until they pay
Yeah.
back?
So let's say you're one of these folks that takes the benefit earlier, then you go back to work the next year, then we have to hold benefits because you're over that $17,640 limit. So how does that come back to you? So the way that works is when you attain your full retirement age, 66 or 67, we're going to reconfigure the benefit and we're going to look back and say how many months did we not pay you benefits because you were making over those thresholds. And every month that we withhold benefits works out to about roughly half of 1% reduction in your benefit. So let's say we withhold 6 months of benefits 1 year, and then when we get to your full retirement age, we're going to look back and say, all right, there were 6 months that we withheld. We're going to take those reduction factors off of your calculation of your benefit, which in this case would result in roughly a 3% bump in your benefit. That's how it comes back to you. So it doesn't come back to you in a check or a lump sum or over a period of time, but you get a permanent increase in your benefit from there on out. Is the way it works. So good question. All right. Yeah.
I'm sorry, did I understand you to say that if you're receiving a pension from your employer, it will reduce your Social Security payout?
The only pensions that would reduce Social Security is if it's not covered by Social Security. So if you're working somewhere, let's say you're working for Nationwide or you're working for GE or GM or any place that pays private pensions, but you're also paying into Social Security while you're working for that employer, you're A-OK. It's the pensions that do not pay a dime into Social Security, like Ohio Public Employees Retirement System, state teachers. They don't pay anything to Social Security. They pay Medicare, but they don't pay Social Security. So we have to use a different formula, and that's where that windfall comes in that she was describing earlier.
You had said something about having been married for 10 years or more, and then is there a benefit when your ex-spouse dies?
Yes. So her question was, for ex-spouses, if your ex-spouse, you're married to them for at least 10 years and they pass away, is there possibly a benefit for a surviving ex-spouse? And the answer is yes to that. So if your ex-spouse passes away and you're currently single, and I'll say there's a caveat to that, or you could be remarried, but you have to be remarried after you turn age 60. So if you get remarried prior to turning 60, then you're kind of locked into your new spouse. But if your ex-spouse passes away, you're married at least 10 years, contact us. We can look into seeing possibly if you're due a higher benefit off of them as a surviving ex-spouse.
But even if I'm drawing my own Social Security?
Yes, even if you're drawing your own, because potentially you could be due more off of them.
You only have to be married 9 months, though, if the current spouse currently dies. Right?
Correct. Yeah. So if you're currently married and your spouse passes away, that 10-year thing is only for ex-spouses, for divorced spouses. For a living spouse, if you're currently, like my spouse passes away, we just had to be married at least 9 months, as long as we didn't divorce. So, good point. All right.
All right. Okay. Awesome. Thanks so much. Thanks, Dan. That was awesome. All right. So before we close out here, like I said earlier, every one of the professionals you've heard speak today will stick around till the last person leaves. If you have any personal questions, they're private. Before you leave, on your tables, there is it green? I'm colorblind. Green, okay. There's a green evaluation form on the front page, and truly we want your feedback because this is the first time we've done this. We're going to do this every year, and we want to get better. So if you could give us any feedback, what we should spend more time on, less time on, if there's any other feedback, please be honest. Second of all, if you'd like to meet with any of the professionals who you've seen speak today, on the back of that page, you can check a box and they will reach out to you. And then last but not least, we have 3 giveaways. So you fill that report card out for us, you give us good feedback. We're going to draw, before we leave tonight, we're going to draw 3 names, and we've got 3 giveaways for those of you who fill those out. So I think that's it. Thank you guys so much for attending. We really appreciate it. Hope you got some value out of the event tonight, and maybe we'll see you next year.